Hey, welcome to Intro to Healthcare Practice, Week 1. This week we're going to just talk in general about the U.S. healthcare system, and I have a couple of videos for you to watch and attached to this PowerPoint, and also a document for you to read. So let's talk about U.S. healthcare system. So in the United States, healthcare is provided by a lot of different entities, the majority of which are privately owned and majority of which are for profit, which explains a lot of the issues that we have with our healthcare system. So insurance is mostly also provided by the private sector, with the exception of a couple of federally funded programs you're familiar with, probably Medicare, Medicaid, SHIP, or also called CHIP, depending on who you listen to, veteran services, etc. Those are federally funded, but the majority of insurance is private sector, also for-profit entities. So again, when you have the for-profits involved, that can lead to some of the challenges that we have experienced within the healthcare system. So despite all of these programs, public and private, a lot of people still remain uninsured despite advances in healthcare towards a more universal system with the Affordable Care Act, also called Obamacare, and now the American Health Care Act, which is on the horizon, also known as Trump Care. But despite the advances, there are a lot of people who still remain uninsured. Currently, the lowest estimate is about 12.2% of the population totally uninsured at some point during calendar year, and then about almost 9% uninsured for the entire calendar year. So that's still a pretty significant number. But that's not as big of an issue as the people who are underinsured. And those underinsured come in, they're calculated into the number of insured, and yet they don't have enough insurance to be able to cover their basic healthcare needs. So that's even a bigger problem than people who are uninsured to some degree. So some interesting things about the U.S. healthcare system is that we spend more money per person on healthcare in the United States than in any other nation in the world. I have some data coming up in the next few slides. Medical debt is still the number one cause of personal bankruptcy in the United States. So it's people who can't afford their health care, or because of healthcare needs, can't afford to pay their mortgage and can't afford to pay their debts because they're paying so much for medications, for healthcare testing, or whatever it is. Number one reason for bankruptcy in the United States is medical debt. We pay 2 times more for infant care than most other nations, but we have a higher infant mortality rate than most industrial nations. Our life expectancy is currently 45th in the world at 79.5 years. If you're interested, Hong Kong is listed as number 1 with a life expectancy of 84.5 years. So, we're doing something wrong. According to the World Health Organization, the U.S. healthcare system is number 1 in terms of how much it costs, number 37 in terms of the performance, and number 72 overall out of the 191 nations that are in this study. So, those are things to think about. Now, the Commonwealth Fund is an organization that does data analysis on a variety of health metrics, and they produce an annual report on healthcare in comparison around the world. So in the 11 countries studied in the 2017 study of the Commonwealth Fund, the United States came in last in terms of quality. So overall, last place out of 11 countries. Access to healthcare, last place. Equity in healthcare, last place. Outcomes, last place. Administrative efficiency, 10th out of 11th, and the only thing that we're even half in the half rank is process. We came in 5th. If you're interested in overall ranking United Kingdom was first, and Australia was second. So we are just slightly ahead of France in terms of overall and Canada. So I have attached the Commonwealth Fund study at the end of this PowerPoint for you to be able to look at. The Institute of Medicine says that the United States is the only wealthy industrialized nation that doesn't ensure that all of its citizens have coverage. And there have been different studies that look at the number of people who have died as a result of not having insurance. And the studies range from 20,000 to 45,000 unnecessary deaths per year in the United States related to lack of health insurance. So that's an astounding number. We're talking about annually. And then a lack of medical care or inadequate coverage is associated with more than 100,000 deaths a year. So just sit on that number for a minute. So research and development. So pharmaceuticals and device manufacture and production is primarily conducted by private companies. It is funded both privately and publicly, with the majority, again, being funded privately. $171.8 billion, that's billion with a B, was spent for research and development in 2016. And that is a 20.6% increase between 2013 and 2016. That is a huge percentage of increase. 67.4% of that money is from private sources, and only about 20% is federally or publicly funded. So the U.S. leads in medical innovation, revenue for new drugs, and devices. So we are a very research and develop oriented country, and we have to think about, you have to balance. We want those new medications. We want those immunizations, et cetera. So the problem being that oftentimes these, again, are for profits. And you see companies like the gentleman who recently went to jail, the one who had increased the cost of the EpiPen so significantly. So there are issues when greed and monopoly and come into play. So if drugs were 100% publicly funded, and we know that that research, drugs are not publicly funded, consumers' savings would be substantial. We would not spend what we spend on medication if medication was public, because these drug companies wouldn't be able to monopolize the pricing, like that monumental increase for those EpiPens. Pharmaceutical companies spend more than twice as much on marketing, advertising, and administration than on research and development. So remember what that research and development number was. They spend twice as much on marketing, advertising, and administration. And part of it is because of who we are as a society. We want to see that commercial that says that this is the best new drug for whatever the ailment is, and we rush to our doctors and ask for that new drug. So they, these pharmaceutical companies, these marketing and advertising companies know what they're doing to appeal to the consumer in the United States. So recently, if you pay attention to the news, President Trump has said that he's going to take on these pharmaceutical companies to reduce the prices. So we'll see where that goes. It's a good goal. If it happens, we'll see what happens in the next several months to see if anything happens to reduce the costs of medications. But unfortunately, what is happening is, let's go back to that bankruptcy issue, that there are many people who can't afford their medications, or they have to choose between food and medicine, and that's just not right. So there's a 2016 study that looked at the U.S. spending, and we spend $3.35 trillion on healthcare, which comes out to an average of $10,345 per person, which is a 4.8% increase from the prior year. Really think about that number. For each of you $10,000 plus has been spent on healthcare. Have you gotten your money's worth? Think about that. So these health insurance costs are rising faster than wages or inflation. And if you publicly or if you have to independently pay for your own insurance, you understand that. Or if you have to pay private pay because you don't have insurance, you also understand that. The cost is astounding. I have a friend with multiple sclerosis who is, and her husband is has insulin dependent diabetes, and they just can't afford the medication. It's his insulin alone is $600 a month, and that's without any of the medications that she needs for her MS. So, those are things that people are experiencing every single day. Part of the reason for this healthcare spending is these advances in technology. We're always looking for new technology, and with these new technologies, it costs more money for healthcare. So if you think about people think about even just a few decades ago, people had at-risk pregnancies and children were born with a specific disorder. They didn't survive. But as a result of there are advancements in technology, sicker and sicker babies are surviving. In my opinion, that's a good thing. But then these babies have these diagnoses that are going to require lifelong health care. So, there are many reasons why the cost of healthcare is increasing. There was a Dartmouth study done recently that looked at, so we have to think about, using healthcare services, and when do we get healthcare services, and how much healthcare services do we get. So this Dartmouth study found that giving Medicare beneficiaries who had severe chronic illnesses more intense health care in the last 2 years of life, and think about that, that's when people tend to have a lot more healthcare services or receive a lot more healthcare services. So this involved, spending more in healthcare, getting more tests, having longer hospitalization, did not improve the outcomes from people who did not receive that level of services. So, end of life, and we're doing all of these medical things, is it really appropriate? Does it really have any benefit? And there was also a recent Wall Street Journal report that said that there are different times during economic downturns, and you tend to see fewer people going to the doctor or seeking out medical services. So when economically things are bad, people are not getting their medications, they're not going to the doctor, and that leads to a whole host of other problems. So about just over 91% of Americans have health insurance. Majority are going to be through employers or spouses' employers, some private pay, some government program. The government programs have restrictions. We'll talk about those in a few minutes. So there's no program that covers all people. As I mentioned, the majority get insurance through their employers. Just over 55%. That number has gone down. And part of the reason is that due to new legislation, the cost of insurance, the cost of providing insurance for employers is increasing. And that's one of the reasons that number is going down. About 14.5% of people purchase their healthcare insurance. This is an increase recently of about 5%. And that's because of the Affordable Care Act, in part the mandate that requires people to have insurance or face a penalty. So the Affordable Care Act has resulted in about 5% more people being covered by health insurance. Prior to this, it was about 20%. Fewer percent who purchase their own, 9% who purchase their own insurance. So, there's a variety of options that you have when you have insurance, whether you pay deductibles up front or you have co-payments for services, etc. But most employers provide services through managed care organizations, and that allows for a decrease in cost than if the patient was billed directly. And we'll talk about that more in the next audio.